We are going to start. Good afternoon, dear colleagues, dear journalists, participants of today's discussion. We are really glad to speak with you today and to tell you about an important topic, health index, how Ukrainians assessed the situation in the sphere of healthcare, their attitude in the regions. I am Natalia. I will moderate today's discussion. Then I will represent our speakers. And now I would like to give the floor to Viktoria Tomashevsky, Director of the Public Health Program Initiative, International Foundation Vidrodzenya. And they organized this survey for the second time. And we now have the laws that were voted for, and they wait for to be signed by the president. So what should we pay attention to, and why do you support this survey? Thank you. And our foundation support this initiative for second year, and we will support this for 4 years. And we want that reforms be introduced in this area. In 2016, we observed initial level, and now we want to see first changes. And 2017 became the year of the legalization of all the reforms concerning the adaptation of laws that were voted, rural medicine reform. So this is the start of reforms, and not only the efforts that are done locally, but also supported by international organizations. When we started and presented the first index, the ministry supported us. Today we spoke with the minister, and she plans the meeting with the regions in order to discuss how this data will be used. And they say data is alternative to medical statistics. This is view of the families who seek medical assistance or do not seek it for some reason. And there is some dynamics and changes we may see, but we should look not only at figures that are recorded, but also we should see the broader context, what is ongoing in oblasts, what projects of technical assistance are implemented, how the oblasts create more autonomy for the institutions that are the institutions of healthcare sector. So you all have brochures. This is abbreviated version, and soon we will have a detailed report. And there is a site, healthindex.com.ua, and there is a comparison between 2016-2017, and you can go on the site and to see this. So there is information and also explanation in order to see the prospects. I would like to ask Viktoria Zakhozha from the Institute of Sociology to comment on the methodology and how the survey was carried out. Good afternoon. Several words about methodology of this research. The collection of data was carried out by Kyiv Institute of Sociology. And additional value of this research is that this is a repeated survey. We can see dynamics, and we wanted to collect the data. The same period, we gathered it during the first wave, because the issues concerning health they are susceptible and depend on this season. So this was done in May till June this year, and it was done the same last year. So the volume is big, more than 10,000 respondents, 18 years of age and older, and they were surveyed in the territory of Ukraine that is under control of the government. And it allows to get the data about the population, and they were asked questions despite their experience, what high accuracy of data, and it provides opportunity to assess separately the opinion of those who seek help during the last year. So we assess not only perception but also the experience. Second peculiarity of sampling was in its design. It was informed in such a way that in each oblast 400 respondents were surveyed, and this allows us to analyze the data not only for Ukraine on the whole but for each oblast separately. So we should look at the percentage of those who answered the questions, but for the full sampling this is useful design. And the questionnaire included a lot of questions, and what we will have today, this is only the most interesting ones, and this instrument was developed in cooperation with international experts and domestic experts in this area, and the questions concerning broad range of issues, starting from overall attitude towards functioning of the system of healthcare and the services we can get, whether we seek help or not, and this perception is formed not only through experience but also from what we see in the media, and also self-assessment of health status and knowing symptoms of some diseases, questions about direct experience in hospital and out hospital, and the assessment of those services that the consumers got. If you have questions about methodology, I will be glad to answer. Thank you, Victoria. Now I give the now we turn to the surveys. So Tetyana Stepurko, Associate Professor of the Healthcare Management Program, National University Kyiv-Mohyla Academy. So Tetyana will present the blocks, and I will ask experts who are today with us, and they will comment what they mean, and to provide more information to our audience. So we are starting. We present the results of the big survey. Why index? Because we need to find the most important results for Ukraine, and we used national strategy of reform and international understanding of the goals of healthcare system, and we established 10 indicators for our index. This is index of health because the goal of the system of healthcare is to improve and preserve health of people, and there are such aspects as accessibility and quality, but on the whole we call it a health index, and it consists of 5 complex views on health, on consumption of medical assistance, and on expenditures. We identified 5 categories and some categories are more subjective, so this is satisfaction with medical assistance, but this is really important because satisfaction can be seen as a psychological barrier in consumption of service. So if people are not satisfied, they will address doctors less. And also the state of health. We surveyed people. We didn't ask doctors. We didn't look through medical documents. This is subjective, but more objective is, for example, the index of mass of the body. One person say about height and weight, and we can tell about the chances of falling ill. And also we have expenditures for medicines and treatment, and all we know that financial risks should be avoided in the system, and this part of index corresponds this goal of healthcare. So we look at medicines and also the emergency assistance costs. So also prevention of disease and efficiency of the use of funds in this area. So if person do not take preventive measures, so the person falls ill, and the system will have more expenses to treat this person. So we have indicators, and the indicator 62%, and last year scores, and last year it was 55. So this figure is not of principle. We should see the dynamics and the difference between oblasts. So we see that the figure grew, so there is a positive trend comparing with the previous year. It doesn't mean that all indicators are on the rise, but some of them rise, and they influence the overall dynamics. So satisfaction is the first indicator that is the most interesting, because all we know that we can be satisfied or not satisfied, and we had a list of questions for people whether they are satisfied, whether they consumed these services or not. This is emotional attitude towards providers of medical services. We ask about family doctors, hospitals, specialists, emergency doctors. So we assessed family doctors and hospital doctors. So on the whole, we are not speaking about patients, we are speaking about population on the whole. So 73% are satisfied, and in Zaporizhzhia, Sumska oblasts, the satisfaction is less than in Kharkiv, Volynsk, and Donetsk, and Mykolaiv oblasts, and the gap is rather big. If you look at the slide, twice the indicators are twice as big. So less satisfaction in hospital treatment. So if you ask people about the focus of reform, we see that in patient treatment needs more attention. So Zaporizhzhia 26, Sumsk 29, and Kyiv 34, and Mykolaiv 86. So the leaders in satisfaction didn't change much. Thank you, Tetyana. I have a question to you, and maybe to other experts as well. It looks like satisfaction of with family doctors is rather high, What does it mean? Because it looks that nothing should be changed, that everyone is satisfied and we should work on the secondary level more. So in order to interpret this data correctly, so satisfaction is rather difficult notion. So we shouldn't say that everyone is satisfied. We should look at it through other parameters of satisfaction. Some surveys that were carried out previously, they identified satisfaction compared with other in other sectors. So in healthcare, it was rather low, and here we see satisfaction with help of family doctor and inpatient help. So this we should look at this in comparison with other indicators. But satisfaction means that a person met in practice what they expected. So expectations are not really high. So it is not really difficult to meet the expectations. So this is the explanation. And maybe they spoke about first level a lot during this year, and maybe this is not about patients. This is about people. They heard that something will change, and communication influences the level of satisfaction.
I'd like to add, as a doctor, of course, vulnerability of people to low quality services differs. We should study this in detail because expectations from primary care are simpler. A person can visit a doctor today, tomorrow. This is one level of unsatisfaction, and if in an inpatient institution a person would like to ask something, but the doctor will come not this day but the next day, there is too much the attitude would be not as good. We now discuss the indicators of satisfaction with services. Primary care is consumed mostly by pensioners and people who used to be satisfied with everything during Soviet times. So those who got used to be satisfied, they just are so tolerant that they can't be unsatisfied. Those who are unsatisfied, they do not visit doctors at all. We assessed the population on the whole, not only those who used to visit the doctor. Are there any more comments? We have 4 other indicators. The second part of indicators is visiting a doctor and preventional examinations, medical examinations. For the system, it is important that the person seeks care when a person is sick. This would control disease. 77% of those who were ill, they sought medical care, and a little more than 20% they didn't visit the doctor in case of trauma or illness. So we should look at those 26%. The next is prevention of diseases indicator. This is electric cardiography, gynecologist examination for women. Both in 2016 and in 2017 the indicator was almost the same, 60%, but we saw that small part of people they really are interested in prevention. This is 26% in Volyn and Kirovograd region. We would like to give the floor to Tetyana, Ms. Tetyana from Naukma. How can you explain this gap? 26% in Volyn region and 87% in Chernivtsi region. Why the gap is so large? In order to find out why the gap is present here, the reasons should be researched in those regions where preventive care is less sought. In those regions, there are more visits to the doctor. The care is sought by larger portion of population. Probably different mechanisms could be in place. Maybe it was some media public awareness campaign, maybe some local programs were implemented. This should be researched more. But we could see from here the lower the number of people visiting preventive medical examination, the larger the number of patients. Then the visits, the cost of the visits increase. If you visited a doctor with for prevention medical examination, you have other result. Then satisfaction results quite differ. We will study this in detail. Now one of the most interesting aspects it is money. How much we spend. Next indicator. Specific feature of Ukraine is a lot of private spending by individuals from patients' pockets for the medical services, either for healthcare services or for medicines. This way of payment is good in order to prevent financial risk. Most of patients are not protected, and the reform, healthcare reform, which is ongoing, it is focused on decreasing the risks. So we are waiting to see the basic package of services and use it. But the percentages are as follows. The medicines spending could be surveyed for inpatient and outpatient clinics. People pay much for, there are cases when people pay much for those medicines which have not been provided to those people. 58% of payers in 2016, the average spending was 550 hryvnias for medicines. The highest spending was in Ternopil region. More than half of payers spend money, and the Dnipropetrovsk region also. The lowest spendings were in Zhytomyr and Khmelnytsky region. The second aspect, it was not included in the index, inpatient and outpatient care costs for methodological reason. You can see this information in our report. The figures are rather impressive. People often pay one or two payment types, formal and informal payment, and some additional other payment. The question, the issue which is used in many international researches, how often, how many times you didn't go to the doctor due to the financial reasons. 30% of Ukrainian patients postponed to visit to the doctor because of financial reasons. But this indicator was higher in last year. It was 42%. We should stress that in Odessa, Cherkasy regions, the medical services are seen as the least financial affordable. Patients, they see them so. 52% of Ukrainians spend money for medicines, and 48% do not pay. Maybe this is because of affordable medicines program initiation. This could be also the evidence that people needed medicines, but they didn't buy them because of the lack of funds. The second aspect, I would like to call you to communicate this aspect more to the population, that the prescribed medicines and also self-prescribed medicines. It is impossible to prescribe medicine for themselves. We should communicate this. This self-treatment and self-prescription should be decreased. Then economic costs of medicines would decrease. As a representative of patients' institution, what do you feel? What are people's attitudes when some indicators are fast increasing? It is like Ms. Tetyana said, what we could do is only hypothesis. We can hypothesize. The first hypothesis is public awareness campaigns focused on increase and the willingness of patients to visit healthcare institutions to see the consequences of reforms. So the initiatives of the government and the affordable medicines program, which was launched in April, all this is of influence most likely on the patients. So this is my hypothesis. We will see what will the situation be next year and what will happen to this indicator. Are there any more comments? I would like to add my observation or hypothesis to explain this. We should understand that many people in Ukraine suffer diseases, lifelong chronic diseases, and they have costs for their treatment during long periods of time, so their burden is far higher. The question is how people are protected from financial risks. At least 50% of people spend a big share of their incomes for the medicines. 500 hryvnias is the big cost for any family, any household. Ukraine really suffers a big burden of chronic diseases, and this burden is on the shoulders of our patients, and protection against the cost is very low. Thank you. We hope the reform would change the situation. Next indicator, please. Next group of indicators, they concern health. Some of them are subjective and some of them are objective. Refusal to immunize children is an indicator. Ukraine unfortunately has immunization as a challenge due to different reasons. Second indicator in this set of indicators is stroke symptoms awareness and death rate, mortality from cardiovascular diseases. We see that the percentage of people who refused immunization, it is a little bit decreased. 25% last year, 21% this year. So we hope the next year this indicator will continue decreasing. Like in other indicators, we have a big variation between the regions. Immunization issue is most problematic in Ivano-Frankivsk, Ternopil regions, where people spend much to pay for medicines, but they do not immunize their children. In Lviv and Kyiv regions, last year, Ivano-Frankivsk and Ternopil region also were problematic. So this is not for a chance. This is a stable trend in these regions to be in focus. It is worth focusing attention on this. The most disciplined parents in Volyn, Mykolaiv regions, 96 and 95% respectively. Thank you. I would like to ask Anisa Kadolska, UNICEF manager. How can you comment on these figures? Thank you. Yeah, these figures describe general trends of what is happening, and we see every year that the number of parents increases year by year who allow immunization and do not refuse to vaccinate their children. What is behind the large figures? What are the details? They are most interesting. From this research, we can see that Kyiv is on the top of refusals, and also it is the first among those where doctors refused to vaccinate children. This meant that those doctors provide low quality consultations to parents or have low educational background, poor knowledge, whatever would be happening in social media or mass media sources, and when doctors say something against vaccination, the chances are higher that parents would not immunize children. There are other barriers as well. Fears about quality and safety of vaccines, contraindications when children are sick, and these indicators, they are also depend on what and how medical staff is communicating information to parents. Parents should understand what will happen after immunization, what actions parents should do in case of some response upon immunization. If mother and the father are ready and they are informed what would be happening to a child after immunization, there would be no problem. This is in Ivano-Frankovsk region, how the situation looks like. When a nurse or a family doctor keep communication and provide explanations about vaccines and possible side effects. In one family, there were 6 or 7 children and they were not immunized, and all of them suffered contagious diseases, and upon communication, upon dialogue with this mother, she took all the children and they were immunized. When a doctor saw my child's vaccinations, I had a complete list, and a doctor was astonished and asked me, are you sure you need another vaccination? But I knew that we needed one against mumps. Thank you.
I would like to add the issue of vaccination. Doctors should provide proper consultation and have the right attitude towards vaccination, because the opinion of the doctor is really important. People trust the doctors, and if they adhere to the protocol and say that children should be vaccinated, but that if they are not sure themselves that this is correct, there won't be proper effect. And also, I would like to speak about the awareness about symptoms of stroke. Here, in our research, we see that a lot of people, 10%, do not know the symptoms. Even those who had the stroke, they do not know these signs of stroke. So here there should be proper communication between doctor and patient, because this communication now is distorted. So the last block of indicators, this is self-assessment of health status, and half of people assess their health as good. And here, the difference between the regions is not sharp. And this year, it is interesting that the body mass index differs more this year than in previous year. Here we see another trend. So this is briefly about this issue. Would you like to comment on this? I would like to focus the attention that these indicators, they really show the risk factors. For example, excessive body weight. This is important indicator. And these days we've discussed the issue of about school children, and there should be proper data about obesity in children and adults. And these indicators provide a lot for public health. I have one more question. Overweight and obesity, is this a lot compared with other countries? So, because this can lead to diabetes and other illnesses compared with the other countries. This is not that critical here. Now, there is a trend. We should also look at children as a separate category. We do not have broad surveys on this, and also we should look not only at overweight problem, but also we should look at obesity and percentage of people who have indicated that more than 30. So there is an international term, diabesity it is called, and this is a pre-diabetes condition, and it is connected with the big weight of the person. So we have other results that we didn't include in this index for some reasons, but this is the attitude towards reforms, and this year less people said that reform is needed. Last year we had 93%, and this year we have 87%. People see that reform is ongoing. That's why this is implemented, and we may see also whether the reform is ongoing. So in Kyiv, the percentage was rather high last year, and this year it is 11. And previously it was more than 60. Last year we looked at Vinnytska, Dnipropetrovsk, and Donetsk Oblast. There were pilot projects in reform of 2011, and Vinnytsia people said that reform is ongoing, and this year the share of these people is smaller. In Poltava region, more people feel that the reform is ongoing. Part of this reform is affordable medicine program. 8% of respondents use this program, and 74% assess this program, those who use this program, as a good program, rather good program. So please be brief, we have several minutes left. So the reform is needed, and people support this, and all surveys show this. There is an error on this graph this year. 23% believe that reform is ongoing in healthcare sector, and last year it was 15%, and this shows the active communication of the ministry concerning reform and the availability of medicines. And people, they expect changes, but the matter is whether they agree with those changes that government proposes. Other surveys show that the biggest support is given to affordability of medicines, reference prices, money follow patients, and some changes are not supported by population, so we should increase communication, and the ministry should communicate not only to population but also to doctors, with doctors, and the people trust the doctors, otherwise they will find another one. So a lot of doctors are afraid of changes, and the institute carried out the analysis in the pilot regions. If primary level doctor did not support the reform, the patients also didn't like the reform, and if the doctor supported the reform, the patients followed him. So in April, they adopted the law on making the healthcare institutions autonomous, and people, they want the implementation of reforms, but the access to affordable medicine and health care is limited, and the government should work on a regulatory basis and to introduce the reform properly in order to have successful experience, as in the case of affordable medicines, and not just some faulty steps. So also the World Bank joined us in this discussion, and now I give the floor to Tetyana in order that she presented the analysis to tell us about the measurement of tension, what the blood pressure is high in people. So I would like to give the floor to our colleague in order that she commented on this.
Every year we try to add some new interesting topic. Last year we considered the pediatrician care. This year we decided to focus on cardiovascular diseases, on blood pressure. The brochure represents efficiency of blood pressure control actions, what people what is the share of people having high blood pressure, what share of people regularly control blood pressure, whether people achieve normal blood pressure, can they stabilize the blood pressure, do they know how to do that? 13% of the total respondents number, they achieved the expected good blood pressure indicator. 1/3 of those who have high blood pressure, this is 1/3 of them, so this is good. There are people who control their blood pressure not regularly, and this is a problem. People should take care of their health every day, but not only when some problem happens. Thank you. Miss Olena, your comment? Thank you. Indeed, this survey is very complex, and the results of the first research were of interest for us, and it could be very useful. We have project jointly with the Ministry of Healthcare in 8 regions, and one of the matters in focus is cardiovascular diseases. To modernize services and to achieve better results, we decided to look at those people who have high blood pressure, how they are covered by medical observations. There is a share of people who know about their high blood pressure, but they do not visit doctor. There is a share of people who got information that the doctors the doctor said to patient that they have high blood pressure, but the doctor didn't consult them that they need to change lifestyle to achieve good pressure. Stabilization of high pressure is achieved only by a portion of people. So there are people who live with high blood pressure, but they do not get treatment, control treatment. The pressure is still high, and as a result we have urgent cases like strokes or heart attacks. And this results in disability and mortality. In Ukraine, this problem is attributable to people of the middle age. So we should prevent disability and death in Ukraine due to this diseases. The results give reasons for concern. Patients should get better communication. Doctors should work with patients to prevent diseases. There is also a small indicator which also is of concern. This is high level of overweight people in Ukraine. Overweight people in Ukraine continue to be people with excessive weight, even if they have hypertension. This means that people continue to be at risk of negative consequences for their health status. So the picture is very interesting, and we will continue to work with it in our pilot regions. We should work more with people, calling on them to take care of their health more and get treatment in time and prevent diseases. Thank you very much. Unfortunately, the next briefing is in several minutes, so we should end our discussion. If there are any questions, we can do this off the records. Excuse us for this. Thank you for your very interesting presentations. Dear colleagues, please ask questions of the record. Thank you for understanding.